Hello, I'm Kinga Marsani, and I'm working as a senior lecturer in mathematical cognition at Loughborough University. And in this presentation, I'm going to talk about dyscalculia and also how our views of dyscalculia have changed in recent years. So I will cover the definitions of dyscalculia, so current definitions, and also how these relate to diagnostic guidance related to dyscalculia. I will also focus specifically on some changes in these diagnostic criteria and maybe controversies or existing disagreements regarding some of the diagnostic criteria. And then I will talk about cognitive theories of dyscalculia and the cognitive profiles of learners with dyscalculia. So before talking about dyscalculia, I just wanted to put this topic in context. So first of all, functional innumeracy is when people lack the necessary numerical skills and competence to deal with everyday situations involving numbers and basic numerical operations. So what this means is that a person who's functionally innumerate would struggle with using timetables, calendars, handling their finances, maybe even with cooking. So for example, if you have a recipe for 3 people but you have 5 guests for a day, you would need to make some basic computations, and the person who would be functionally innumerate would struggle with these as well. So quite shockingly, I would say, government statistics suggests that more or less half of the working age population in England have the numeracy level of a primary school pupil, and more or less 80% of adults can be considered functionally innumerate. So we have a general problem with numeracy in the UK. And what we can also see in the educational system is that by the end of secondary school, there's a huge gap between high and low achieving pupils. So this gap can be as large as corresponding to 8 years of schooling, and this is actually larger than in most other countries. And of course, having a population with relatively or actually quite low levels of numeracy has a cost to the economy as well, which is quite large. It's estimated to be up to more than £30 billion per year, which means that a lot of these people are not able to fully contribute to the economy and to the workforce. I think if we focus on the individual, so what happens to a person who has very low numeracy levels? Basically, it's not just an issue for finding a good job or being able to obtain higher level qualifications, but these people also have an increased risk of unemployment and mental and physical illness, and even higher chances of arrest and incarceration. And if it's not so clear for you why low numeracy levels would be related to physical illness, for example, you should just consider that when you take medication, for example, you would often have to follow. So for example, there are some restrictions that if you just took one dose of this medication, then you cannot take another one for at least 3 hours, for example. So people with low levels of numeracy would generally struggle with following instructions relating to medication regimes, but it can also be related to using some equipment or machines safely. So they would have a higher risk of having some accidents as well. So the most commonly used diagnostic manual is the Diagnostic and Statistical Manual, or DSM, of the American Psychiatric Association, and they use the name specific learning disorder in mathematics to describe dyscalculia. And I just highlighted here a few important points in these diagnostic criteria. So, for example, one important thing is that dyscalculia involves persistent, substantial difficulties in mathematics learning and using academic skills. Academic performance should be determined through standardized achievement measures and comprehensive clinical assessment. So what is important here is that you have to use a standardized achievement measure which corresponds to the education system of the person. So obviously there are different school starting ages in different countries, so you have to take into account the education that the person received and then compare their performance to other learners in this educational context. And I think it's also important, so it's not just about saying if a person performs low, that there should be a particular cutoff, and below this the person should be categorized as dyscalculic. So going back to the first point, the struggles, the problems should be persistent, so they should exist over a period of time. And then the other important point is that comprehensive clinical assessment should take place, which means that we should also consider the person's maybe family history, whether they have any other learning difficulties, whether they have any sensory issues, or whether they had any for example, chronic health problems which would have resulted in missing time at school and so on. So it has to be so basically the person's circumstances have to be taken into account as well, and not just their mathematics performance at that moment. And on the basis of this, clinical synthesis should take place, where all of these this information about the person is considered together to make an informed judgment whether their maths difficulties are really inherent to this person, or whether maybe they arose due to some environmental or other factors. So it's also important that the difficulties must not be better explained by intellectual disabilities. So I already mentioned neurological or sensory or even motor disorders. So if they have some other health conditions which could have resulted in poor mathematics performance or problems with access to learning materials. But it's also important that if the person has intellectual disabilities, so the cutoff point used here is around an IQ of 70 or lower, then their mathematics difficulties would not be considered specific mathematics difficulties, but to be the result of these intellectual disabilities. And their difficulties must not be explained better by psychological or psychosocial adversity, or by speaking or not speaking the language of instruction as their first language. So that's or that they didn't have access to adequate school learning, an adequate school learning environment. So there are many different factors that should be taken into account, and it's also important for any DSM diagnosis that the deficits or the problems must cause significant interference with academic or occupational performance or with activities of daily living. So normally you wouldn't diagnose a person with a developmental difficulty or any kind of mental or neurodevelopmental condition unless they really struggle and they experience difficulties in their everyday lives. And it's also important to consider that severity levels can vary from person to person. So this also needs to be specified as part of the diagnostic process. So what is also important is that difficulties should be present over a prolonged period, so they should be persistent. The DSM actually specifies that they should persist at least for 6 months, despite the provision of targeted interventions. And this is slightly problematic in terms of a UK school context, because targeted interventions are usually not available for children who are not officially diagnosed with a developmental disability. But basically the idea here is that these children should continue to struggle even when some support is provided for them. So their problems shouldn't be easily remedied by providing targeted interventions. So they should be severe and persistent, and to some extent at least resistant to interventions. And I think what is also important, and which is kind of different from some other conceptualizations of dyscalculia in the DSM, that basically mathematics difficulties cover all aspects of mathematics. So they involve difficulties mastering number sense, number facts or calculation, and also problems with mathematical reasoning. So it's not just a problem with some basic numerical processes, it kind of extends to all different areas of mathematical cognition. So developmental psychologists usually use the DSM-5 definition of dyscalculia, but other practitioners, especially in England, often rely on the BDA or the SPLD Assessment Standards Committee's definition of dyscalculia, which is, I would say, it's quite similar to the DSM definition of dyscalculia, but there are also a few differences which I want to highlight here. So dyscalculia is a specific and persistent difficulty in understanding numbers, which can lead to a diverse range of difficulties with mathematics. So far it's very similar to the DSM-5. It will be unexpected in relation to age, level of education and experience, and occurs across all ages and abilities. I think here unexpectedness should be considered. So there's something to consider about the idea of unexpectedness, is that first of all, people with dyscalculia will often have comorbid difficulties. So when we think about dyscalculia as a specific and unexpected difficulty, it's actually usually not the case, in the sense that these learners will have other developmental conditions, or if they don't have other developmental conditions, they will have some differences in their general cognitive abilities compared to other learners, which I will cover later in this talk. So I would argue that to talk about an unexpected difficulty is probably slightly misleading. Then the definition also says that mathematics difficulties are best thought of as a continuum and not a distinct category, and they have many causal factors. I think this fits very well with the DSM definition as well. And dyscalculia falls at one end of the spectrum and will be distinguishable from other maths issues due to the severity of difficulties with number sense, including subitizing, symbolic and non-symbolic magnitude comparison, and ordering. Yeah, so I would say that maybe the DSM definition is a little bit more or a little bit broader, in the sense of also including mathematical reasoning and more complex mathematical skills, and it doesn't just focus on very basic numerical skill. And it can occur singly, but often co-occurs with other specific learning difficulties, mathematics anxiety, and medical conditions. And I would say it's not just other specific learning difficulties, it can be various other types of neurodevelopmental disorders as well. So something that is really important to note is that the DSM-5 compared to the DSM-4, which was the previous edition of the DSM, no longer applies a discrepancy criterion between intelligence and mathematics skills. So the previous version of the DSM required at least one standard deviation difference between mathematics skills and intelligence. So what it means is that if you think of a typical standardized test, the population mean would be 100. So for example, for intelligence, an IQ of 100 would be average for the population. One standard deviation difference would be 15 standard points lower than the population mean, so that would be around 85. And so the idea was that this person with dyscalculia should have very low mathematics skills, but their IQ would be close to the population mean, and so this is a very substantial difference. And of course, saying that now we don't expect this this difference between IQ and mathematics, it has very important implications for both the prevalence and the characteristics of dyscalculic individuals. Another important thing is that the DSM is not the only internationally used diagnostic manual. So there's another one which is published by the World Health Organization. It's called the ICD, and the current edition was actually just published in 2022. It's called the ICD-11, and there has been an important change in the ICD definition of dyscalculia as well, in that the previous definition talked about impairment in arithmetic skills and basic computations, and now they acknowledge that dyscalculia also involves problems with more complex mathematics skills. So this is quite an important change. But if you look at the literature, what you will actually find is that many articles, especially which were published some time ago, talk about specific arithmetic difficulties, so they consider dyscalculia as a problem with arithmetic skills. And what is also important, if we look at the ICD-11's definition of dyscalculia, is that it still includes the maths IQ discrepancy criterion. So they still expect that a person with dyscalculia would have much lower mathematics skills than what could be expected on the basis of their general intelligence. So they have, this is kind of similar to the SASC definition of dyscalculia, to kind of consider dyscalculia as a somewhat unexpected, unexplained difficulty with mathematics. However, I think it's important to note that I would say that on the basis of research evidence, this discrepancy criterion is quite dubious, in the sense that so one thing is that it's not really reliable, not really stable across time. So if you measure a child's IQ and their mathematics skills at one time point, and then measure both of these skills again a bit later, the difference between the two measurements will vary quite a bit. And then I think another important consideration is that what it means is that a person who has significant cognitive issues and struggles with mathematics, but then they also have some additional problems with working memory, maybe spatial skills and so on, they wouldn't be eligible for support on the basis of this definition of dyscalculia, because we would be looking for a person who struggles with maths only, but they actually have really good skills in other academic contexts. So actually these learners would be very high functioning and probably very successful in other areas of learning, and they would be eligible to support, but other learners who really struggle in multiple different ways, they wouldn't receive support. So this just doesn't seem right, even from a practical perspective. So regarding the estimates of prevalence of dyscalculia, as you can kind of infer from changes in diagnostic criteria, there have been different approaches used to identify learners with dyscalculia over time. And what is really interesting is that whatever criterion has been used, actually the estimates of prevalence haven't really changed over time. So I just included a few examples in this slide regarding prevalence estimates. So for example, one study in the 1990s used a criterion of 2 years below grade level in arithmetic in the presence of normal intelligence, and they said it's about 6% of school children who could be considered dyscalculic. Then another approach by Geary in the early 2000s, he talked about mathematical learning difficulties and identified children with working memory impairments and other with impairments in other general cognitive skills as having mathematical learning difficulties, and he proposed that the prevalence would be between 5 to 8%. Then Butterworth, again a completely different approach based on very basic numerical skills, including subitizing, for example. He also proposed a prevalence of between probably 3 to 6%. And then a very similar prevalence estimate by other researchers. So in the end, what we can say is that interestingly, whatever criteria are used, the prevalence estimates tend to be around maybe 5 to 6%, or a little bit, or just a little bit lower than that. So in the following, I will describe a study that I conducted a few years ago in Northern Ireland with primary school children. So this was quite a large sample of children, and we used the school's records of their mathematical performance and then other information about the children, including their socioeconomic status, whether they spoke English as their first language, whether they had any other diagnosed difficulties or developmental conditions, and so on. So we used a very rich set of data from a large number of children, and we also used the DSM-5 diagnostic criteria, which were kind of quite newly published at the time of this study. And what we found was that about 6% of the children in this group had persistent severe difficulties with mathematics. So this was what we considered evidence for severe difficulties, is that their mathematics performance was 1.5 standard deviations below the population mean. So this means a standard score of 78 or less. And but when we also took into account other potential explanations for these persistent severe problems with mathematics, so for example, if the child had neurological or sensory difficulties, then we found that 5.7% of these children appear to have a dyscalculic cognitive profile. And what is also important, and I really wanted to highlight this finding, is that if we actually apply the discrepancy criterion so this IQ and maths discrepancy criterion, that there should be one standard deviation difference between the children's mathematics scores and IQ scores. The prevalence drops quite dramatically to 1.1% in this population, which means that we would exclude more than 80% of the children who have persistent and very serious mathematics difficulties. So obviously this is a real problem, that if we used this discrepancy criterion, these children who really struggle and have very serious mathematics problems wouldn't be eligible to any support. And what we also found in this study, because we were able to get estimates of their mathematics performance over several school years, and also we had measures of their IQ at different time points. What we also found is that although there was some discrepancy between their mathematics scores and their intelligence, this tended to be between 7 or 8 standard points on average. So that's more or less half standard deviation difference. And also that this gap, as I said before, changed over time. So sometimes it became smaller, sometimes it became larger over time. And then there was also quite a huge variation in the actual discrepancy between mathematics skills and IQ in the children that we identified as potentially dyscalculic. So there is also the question, which I kind of mentioned before, whether dyscalculia is really specific. So actually the DSM-5 doesn't have a separate diagnostic category for dyscalculia. It uses the umbrella term of specific learning disorders, which includes specific learning disorders in mathematics, in reading, and in writing. So this kind of suggests that the DSM kind of expects comorbidity between these conditions. I should also say that I think now in the developmental literature, developmental psychology literature, the expectation is that comorbidity between different developmental disorders tends to be the rule rather than the exception. And I think this is also important if we consider that most children in schools would have one diagnostic label. So usually educational psychologists try to identify one key problem, and then they maybe attribute other problems that the child experiences to this kind of core problem. But actually, I think the correct approach would be to acknowledge that children can have several comorbid developmental problems, and also trying to help or trying to consider all of these diagnoses together instead of focusing on just one of these. So going back to our study in Northern Ireland, what we found was that actually 81% of children with dyscalculia had some kind of comorbid condition, and this varied quite widely. So most of them, or maybe half or almost half of the children, had some kind of general cognitive and learning difficulties. Speech and language difficulties were quite common in these children, and then a small proportion had dyslexia and dyscalculia together. So now I'm moving on to the cognitive theories of dyscalculia. So one probably quite well-known hypothesis is the so-called defective number module hypothesis of dyscalculia, which was advanced by Brian Butterworth, mostly starting in the 1990s. And the idea for this theory is that we have a specific part of our brain specialized in processing numbers, and dyscalculia would arise from a selective deficit in this kind of magnitude processing module in our brain. And this approach, this number module approach focused on an inborn capacity for recognizing and mentally manipulating discrete quantities. So the idea is that, for example, if you think about subitizing, so when you see a pattern of dots and you kind of immediately say, especially if it's a small number, you can immediately say, okay, this is 3 items or this is maybe 5 items. So if you look at this drawing, which was actually prepared by my son, who is 3 years old, what you can see is that it's kind of evidence of this basic number sense, that even though when he made this drawing he couldn't count, I mean he knew the number words but couldn't actually properly count objects. What you can see is that the mommy deer and the baby deer, they both have 2 antlers, so he was already kind of able to recognize 2, but if you look at the number of legs, it's 6, so basically it's not exactly 4, but it's kind of close. So he has some kind of sense of how many items there should be, even though he's not able to, or at this point he wasn't able to count the number of legs that deers would have. Also in this approach of this number module in the brain, or in this approach, understanding numbers is largely independent of language. So we would just have a sense of numerosity without necessarily attaching verbal labels to these. And so if you think about a specific number module, then you would also expect that this should have a specific place in our brain. And actually some parts of the brain were identified as potential or likely candidates for this number module, including especially the intraparietal sulcus and the angular gyrus in the brain. So what does the IPS actually do? The IPS has been the focus of many investigations into numerical cognition, and we know that actually it does. It is involved in numerical processing. It's involved in arithmetic. It's involved in numerical magnitude judgment. So, for example, when we compare the numerosity of sets or numerals. And it's also involved in the estimation of the numerosity of small sets, for example. And if this part of the brain suffers an injury, then this would severely affect normal numerical performance. So people who have a specific injury in this part of the brain would struggle with numerical cognition tasks. At the same time, the IPS has many other functions, so it would be a real overstatement to say that this part of the brain is only concerned with numerals or numerical processing. It's also part of the dorsal visual pathway, for example, which is also called sometimes informally the VER system. So VER is something seeing things in space, and also it's involved in visually guided action, so finding a target and also grabbing a target. It's also involved in orienting attention and sustained attention, and inhibition, so suppressing task irrelevant information. So basically it is not only involved in processing numbers, but also in processing visual and spatial information, attentional processes, inhibition, and even it's part of a network which is responsible for intelligence and reasoning. So it has lots of other functions as well, and not just numerical cognition. So another approach which is slightly different from Butterworth's number module hypothesis is the number sense approach. So you are probably familiar with the term number sense. And the idea here is that instead of being born with the capacity for judging discrete or estimating discrete quantities, we have an inborn capacity for representing continuous quantities, which means that it's not just about numbers, but also we use this system to think about space and time as well. And this approach also assumes an important link between numbers and language in the brain. So basically, we can only develop a full understanding of the number system if we also have the correct language to describe numbers and relations between numbers. And also some approaches which rely on this number sense approach, they also assume that maybe sometimes the problem is not necessarily with basic number sense, but how this is linked to symbolic representations of numbers and numerical language. So that so we have to connect our basic representations of numbers to the appropriate number words and the appropriate number symbols as well. And sometimes the problem is to make the connections between these different representations of numbers. And so this is just to demonstrate what this what continuous magnitudes look like. So basically we represent the number sequence spatially using the mental number line, but we use quite similar representations to show timelines as well, so or changes over time. So you can see this mental timeline of a developing plant, and also we are quite familiar with representations of evolutionary time in terms of spatial sequence of events. And I also wanted to say that when we look at dyscalculia symptoms, although this is not very well researched, but if we look at informal clinical reports of problems that dyscalculic people will experience, these will actually involve lots of things other than just problems with numbers, including problems with following sequential directions, learning musical concepts, telling left from right, struggling with some concepts of time and direction, spatial orientation, and keeping track of time, planning events, and so on. So there are lots of difficulties which actually relate to issues with spatial and time-related processes as well. So I already mentioned in relation to comorbidities that children with and also in relation to the discrepancy criterion that children or people with dyscalculia will likely have other problems which are not closely related to numerical processing. So in this slide, I just present very briefly some evidence for the role of domain general scales in dyscalculia. So scales which are not specific to the domain of number. So there's quite a lot of evidence that dyscalculia will be associated with working memory problems, problems with inhibitory function, attentional function. So maybe when you consider this, you can also think about the slide about the functions of the IPS. So all of these are represented in a single system. Then ordering sequencing scales, including temporal order and learning movement sequences. Again, this is something that I already mentioned. And there's also problems with verbal reasoning skills in dyscalculia. And especially some problems have been identified in transitive inferences So for example, when you consider the problem dogs are stronger than gorillas and rabbits are stronger than dogs, are rabbits stronger than gorillas? What you have to do is, first of all, you have to inhibit your beliefs about the conclusion, and what you also have to do is kind of work out the relationships between the different items, so the dogs, gorillas, and rabbits, based on the description. And what you find that this is something that dyscalculic learners would find difficult. So in the end, if you consider the idea of a special kind of circumscribed number module, what we believe now, based on neuroscience evidence, is that actually a network of different parts of the brain is contributing to numerical cognition, and basically it's a very sensitive system. So if there are injuries or there are problems with any parts of this network, and the connections between these the parts of this network, then an individual will experience problems with mathematics. And what is also a consequence of this extended network of different parts of the brain which contributes to numerical cognition is the heterogeneity of potential problems that can arise if some parts of this network don't make a good contribution. So basically the idea is that that dyscalculic learners can show different types of problems, and it's because how the brain represents numbers and how we process numerical information, how the different parts of the brain that we use for numerical problem solving, it's like a very complex system, and usually several parts of the brain work together when we are dealing with mathematics. So I also wanted to kind of mention the issue of whether dyscalculia is actually resistant to interventions. So I mentioned the DSM definition of dyscalculia, which says that these serious and persistent difficulties with mathematics should persist over at least 6 months despite targeted interventions. So in this case, what this definition seems to suggest is at least some level of resistance to intervention. So this would mean that it's not easy to, or these serious difficulties won't just easily go away if you provide any targeted interventions. And actually some researchers suggested that that resistance to interventions may be an important diagnostic criterion or an important feature of dyscalculia. And also, if we consider that neurodevelopmental disorders are lifelong conditions, then maybe we could also expect that dyscalculia should be resistant to interventions, and that these difficulties shouldn't just go away over time or if we provide interventions. At the same time, if we look at the DSM, interestingly, although it doesn't give a specific estimates of dyscalculia in children, but it basically says that that about 5 to 15% of children would have some kind of specific learning difficulties. So this is not just about dyscalculia, but dyscalculia, dyslexia, or dysgraphia. And then they give a prevalence estimate of around 4% in adults, which kind of suggests that maybe prevalence rates or the proportion of people who would meet diagnostic criteria decreases over time. Going back to the study that we did in Northern Ireland, what we actually found was that the proportion of children with a dyscalculic profile actually quite significantly decreased across year groups. So whereas in year 4 we found that 7.4% of children seem to have a dyscalculia profile, this decreased to 6.4% in year 5, and then 5.8% in year 6, and then 3.8% in year 7. So it seems that although these children obviously wouldn't just suddenly became really good at mathematics, but the proportion of children who kept struggling seemed to decrease over time. So it seems that there is a possibility for interventions to be efficient. And of course, we don't know what happened to these children, whether it was just up to really good quality education that they received at school, whether they received any specialist intervention. We don't know, but I think it gives hope that the proportion of children with these persistent, very severe difficulties of mathematics decreased over time. So it seems that there is at least some scope for providing interventions and decreasing the severity of the problems in this way. And then there's also the question, which is, I would say, not very well researched at this point, whether dyscalculia or whether dyscalculic pupils should receive very similar interventions to other pupils, or whether there were any specific ways that dyscalculic children should be taught. That I would say that there's no agreement in the literature about this yet. Overall, what I wanted to say in conclusion, dyscalculia can be a debilitating condition. It can really seriously affect people's life chances, and especially because it's not just, although it's called a specific learning disorder in mathematics, it actually doesn't just affect numerical skills, but also spatial and temporal processing, and also usually general cognitive resources are implicated in general. So these learners can really struggle, and comorbidities are very common as well, including, I didn't talk about comorbidities with anxiety and depression, but this is also quite common in neurodevelopmental disorders and specific learning disorders as well. And I think it's also important to keep in mind so what I said about the distribution of skills and contributing cognitive processes, is that dyscalculia is a really heterogeneous condition, and each learner will have their own specific cognitive profile, their own strengths and differences, and any assessment should take it into account, and any intervention approach should take it into account as well. Thank you so much for your attention.